We live in an era of unprecedented medical advances, yet some conditions continue to puzzle researchers and pose significant challenges to healthcare providers. One of these diseases is chronic obstructive pulmonary disease, COPD. This chapter provides an introduction to COPD, its prevalence, symptoms, and the state of current medical understanding. It gives a comprehensive and understandable overview of the disease. With an increasing global aging population, COPD has been steadily on the rise. According to the World Health Organization, COPD is expected to be the third leading cause of death worldwide by 2030. COPD is a chronic lung disease characterized by persistent respiratory symptoms and airflow limitation that is due to airway and/or alveolar abnormalities, usually caused by significant exposure to harmful particles or gases. It encompasses two main conditions: emphysema and chronic bronchitis, which often coexist. Understanding the symptoms of COPD is critical in the early diagnosis and management of the disease. COPD shows a wide range of symptoms, but the primary ones include persistent cough with or without mucus production, shortness of breath, and chest tightness. Given the chronic progressive nature of COPD, it's essential that we invest in understanding the disease's mechanisms, its progression pathways, and the innovations in its treatment. The more we learn, the closer we get to improving patient outcomes and quality of life. Engaging in this book, you will get an in-depth understanding of COPD's intricacies, the latest scientific advancements, and the future direction of COPD research and healthcare policies. Brace yourself for an informative and riveting journey into the realm of COPD. Chronic obstructive pulmonary disease, COPD, is a progressive lung disorder that entails severe consequences for overall health and quality of life. This chapter delves deep into understanding how COPD impacts human lungs. Through a close examination of the physiology of the lungs, we start our journey into the implications of this disease. COPD results from an interplay of genetic susceptibility and environmental factors, primarily tobacco smoking. Inhaled pollutants initiate an inflammatory response in the lungs, causing thickening and narrowing of the airways, often accompanied by mucus overproduction. This inflammatory response is the crux of COPD, as it results in gradual, irreversible damage to the lung tissue. As the disease progresses, the altered lung architecture impairs its primary function, the exchange of oxygen and carbon dioxide. Patients experience breathlessness, frequent exacerbations, and decreased exercise capacity. Late-stage COPD can further lead to complications such as heart disease and lung cancer. Early diagnosis and intervention are crucial in managing the disease progression and improving the patient's quality of life. Understanding the impact of COPD on the lungs, hence, is vital for a comprehensive approach to its management and treatment. In this chapter, we delve into the complex machinery of the human body, focusing specifically on how chronic obstructive pulmonary disease, COPD, brings about cellular and molecular alterations, leading to damage in the lungs. The current understanding of these mechanisms raises several fascinating questions about the interplay of genetics, environment, and lifestyle in the progression of this disease. An intricate player in this landscape is lung inflammation, an abnormal response of the body's protective mechanism. A journey through COPD begins with exposure to combustibles such as tobacco or environmental pollutants, which aggravate our lung tissues. As a reactive measure, our bodies summon neutrophils and macrophages, white blood cells that usually protect us. However, in COPD, they release proteolytic enzymes and oxidants, leading to tissue damage. Beyond the inflammation, the tissue repair process, which would normally be the body's next line of defense, is disrupted. This enables the proliferation of damaged cells and contributes to the obstruction of air passages. Let's turn our attention to another phenomenon, emphysema. Comprising a part of the COPD complex, emphysema is characterized by the destruction of lung tissue, especially the alveoli, tiny air sacs where the exchange of oxygen and carbon dioxide occurs. As we delve further into this chapter, we will examine data from recent studies on cellular and molecular mechanism, use case studies to illustrate how these forces work, and discuss the potential for targeting these processes in the development of new treatments for COPD. Chapter 3 opens a discussion on the potential trajectories of COPD progression. It takes an in-depth look at the different factors that could potentially affect the course of the disease, including the patient's age, severity of the illness, exposure to harmful external stimuli, and the presence of other diseases. The progression of COPD is a unique journey for each patient, shaped by numerous factors that can vary widely from individual to individual. Understanding these factors and their potential interactions is crucial for medical professionals in predicting disease progression and formulating personalized treatment strategies. Age is a decisive element in disease progression, with older individuals generally presenting with more severe symptoms, explained the medical expert vehemently. The disease's severity at the time of diagnosis also significantly impacts its progression. Generally, the earlier COPD is detected, the more favorable the prognosis and the more effective the treatment. Moreover, continuous exposure to harmful external stimuli, primarily smoking and environmental pollution, significantly accelerates the progression of COPD, added the expert. Comorbidities such as heart disease and diabetes may also complicate the progression of COPD, as they may influence the severity and the management of the disease. Expanding on this, the chapter delves into each factor in further detail, highlighting key scientific studies and findings, and presenting diagrams and graphs for a better understanding of the subject matter. It further explores the synergistic relationship between these factors and their cumulative impact on the progression of COPD. Chronic Obstructive Pulmonary Disease, COPD, has a profound impact on the patient's quality of life. However, with advancements in medical technology and research, the landscape of COPD treatment has changed significantly. This chapter will delve into the latest innovations in COPD treatment, their efficacy, and potential areas for future development. Focusing on COPD treatments, the advancements are numerous. From pharmaceutical approaches such as bronchodilators, corticosteroids, and antibiotics, to non-pharmacological therapies like lung volume reduction and pulmonary rehabilitation. The advent of bronchodilators revolutionized the treatment of COPD. The principle is they relax the muscle around the airways, allowing them to open up, making it easier for patients to breathe. The advancements don't stop there. The next big leap in COPD treatment might come from precision medicine, with the development of new drugs that target the individual genetic mutations that cause COPD. However, it's not just about medication. Non-pharmacological therapies like pulmonary rehabilitation, which includes exercise, education, and behavior change, have shown great promise in improving the health and quality of life of patients with COPD. Chapter 5 delves into the potential use of personalized medicine in COPD treatment. This upcoming approach promises a tailored therapy that aligns with an individual's unique genetic makeup, lifestyle, and disease characteristics. A central tenet of personalized medicine is that therapeutic interventions can be tailor-fit not just to the disease, but to the person. This is done by taking the individual's unique profile into account: genetics, lifestyle, and the disease's natural progression. With COPD, we've seen that the one-size-fits-all approach to treatment is inadequate. Each patient's disease state is influenced by different factors, genetics and lifestyle being key among them. Thus, a more personalized approach is needed. On the forefront of this personalized medicine initiative is the use of genomic technology. By sequencing a patient's genome, we can identify genetic variants associated with increased susceptibility to COPD, response to therapies, and predict disease progression. With this information, we can implement more targeted, effective treatments earlier in the disease process. Beyond genomics, however, personalized medicine also considers lifestyle factors like smoking, air pollution, and occupational exposure to harmful particles, all of which significantly impact the course and severity of COPD. So, in addition to identifying genetic targets for treatment, efforts to modify these lifestyle factors are also an essential component of a personalized approach. Personalized medicine is the future of COPD treatment. With growing advancements in technology and research, we can customize an individual's treatment plan and maximize effectiveness while minimizing adverse effects. However, the implementation challenges such as cost, data privacy, and infrastructure development must also be addressed. As we reach the conclusion of our comprehensive analysis of chronic obstructive pulmonary disease, COPD, we reflect on the present and future challenges in managing this condition and the need for continuous innovation in treatment strategies. COPD, a progressive and incurable disease, remains one of the top causes of morbidity and mortality globally. Despite advancements in understanding the disease's mechanisms and progression, it continually poses a significant threat. The current treatments and management strategies, while offering some respite, have not fully curbed the progression of COPD. Limitations in existing therapies, the side effects caused by long-term use of these treatments, and individual variability in drug response further complicate the scenario. This puts into perspective the need for continued research and innovation in the development of potential therapeutic interventions. Efforts to tailor treatment based on an individual's genetic makeup and the severity of their disease could revolutionize COPD management. Additionally, the future of COPD treatment seems promising with advancements in the fields of regenerative medicine, genomics, and targeted drug delivery. Another aspect that warrants attention is the enhancing of policies and public health strategies that enable early detection and intervention, reducing the burden of the disease. This not only improves individuals' health outcomes, but also decrements the economic burden posed by COPD. Coping with COPD is undoubtedly challenging, both physically and emotionally. The road ahead, albeit demanding, is paved with opportunities for innovation, ensuring a better quality of life for patients living with this disease and a decrease in the global burden imposed by COPD.